Hi, Medical Wildcats. I'm Joseph Guggenheim. I'm a 1972 alum of the medical school. And today I'm going to start a two-part presentation on Chicago's lost medical schools. There are a little over 30 medical schools that existed in Chicago in the late 19th and early 20th century that have faded into oblivion now. And today's presentation will be on the medical sects on which many of these schools were founded. And next month, I'll be talking about the individual schools themselves. There were over 400 medical colleges in the United States and 39 in Illinois and many in nearby states. And those that have survived until today were the regular medical schools, often called orthodox or allopathic. Allopathic was actually a derogatory term. Those that were closed were based on sects, and the sects we're talking about are the ones that had medical schools in Chicago: Physiomedicalism, Eclecticism, and Homeopathy. These were degree-granting institutions. The reason they became popular was regular medicine often offered only ineffective and dangerous treatments, including calomel, which was mercury chloride, which is thought to have led to George Washington's death, purgatives, and bloodletting. The unorthodox practitioners that followed these sects did not see themselves as members of cults or sects, but instead saw themselves as reformers, healers, revolutionaries, and members of new philosophical schools. They argued that the true test of any medical system was patient satisfaction, especially in chronic diseases. And they argued that the medical licensing laws in the United States took away the individual's rights to make their own decisions about health care. And this picture on the right shows the homeopathy impression of allopathic medicine, the horrors of allopathy, as this is called. So the medical sects that we'll talk about today are Thomsonian medicine, also called Thomsonism, Physiomedicalism, Eclecticism, and Homeopathy. The first one is Thomsonian medicine, named after Samuel Thomson. Thomson was born in New Hampshire in 1769 to a poor family. He had an abusive father, he had a clubfoot, and he was a sickly child. He was familiar with the local flora from working in the fields. At age 4, he encountered a plant he had never seen before while he was searching for his cows. And out of curiosity, he decided to chew on some of the pods from this plant. Immediately, his throat began to burn and he started vomiting. Others tried it with similar results, and they had profuse sweating. He urged one of his fellow workers to try the plant, and he had the same result. He began to sweat, vomit, and become pale as a corpse, as Thomson described it. But within a few hours, he said he felt better, much better than he'd felt in a long time. The plant was Lobelia inflata. And you can see in this picture on the right that you can still buy extracts of this plant if you enjoy vomiting and sweating. Thomson studied under so-called root doctors. His wife had fits after delivering their first child and was seen by 7 regular doctors, but nobody could concur on what the treatment should be, and nobody could cure her. But she improved with treatment by a Dr. Bliss, a local root doctor. Thomson convinced Dr. Bliss to live on his farm with the family. When their second child had a purulent fever and scarlet fever, purulent rash and scarlet fever, they called on Dr. Bliss. But his daughter did not improve with Dr. Bliss's care. So Thomson decided to take things in his own hands. He wrapped mother and child in a blanket, instructed the mother to hold a shovel of red-hot coals between her daughter's feet, and then he poured vinegar on the shovel to make some steam until his daughter could breathe more easily. He then applied cold water compresses to the child's eyes, followed by marsh rosemary eye wash, and she got better. He acquired a reputation as a root doctor among local farmers, but people were reluctant to pay him because they said he was an uneducated farmer just like them and not a real doctor. This picture is from a book about him, and I question the authenticity of the picture. It doesn't look at all like the other pictures of Dr. Thomson. These were some of Dr. Thomson's tenets. Heat is synonymous with vitality, where cold was the cause of disease. To restore the heat to its natural standard was the only way health and strength could be produced. Heat radiated outward from the stomach, and concretions could build up in the stomach, impairing absorption. Clearing the stomach of these concretions was tantamount to restoring health, and disease arose when the internal heat of the stomach was obstructed from circulating to the periphery. He advocated sweating therapy. He sought to induce a fever to assist the body. He called the physical symptoms of coldness the canker. And he had 6 medicines. Number 1 was lobelia, and he said this was of prime importance for restoring heat. This later became his medicine number 1. He said it was like kindling wood. It started the fire but would not maintain it. It promoted the movement of the stomach's heat but soon exhausted itself. So he needed a medicine to continue the heat, and that was cayenne pepper. This sustained the heat of digestion after lobelia had kindled it, and cayenne pepper became medicine number 2. Medicine number 3 was bayberry bark, and this continued the work of removing the canker without promoting emesis, according to Thomson. Medicine 4 was herbs, either a single herb or a combination, and this corrected the digestive organs and enhanced secretion. Medicine number 5 was restoratives to the entire body, and it was made of peach kernels, cherry pits, and myrrh resin. He said this was especially important in the treatment of dysentery. And medicine 6 was what he called rheumatic drops, equal parts myrrh gum and cayenne pepper. And this was used to treat pain and restore circulation. The treatment was stopped when the practitioner was sure the canker had been eliminated. Thomson went in the business of promoting his medicine. In 1813, he was awarded 6 patents for his 6 medicines. And then for $20, you could purchase entry into his Friendly Botanic Society. And for an additional $2, you could purchase his book, as shown on the right. And by 1839, there were over 3 million adherents to his system, many of these being regular physicians. You can see on the picture on the left that he does not look at all like the picture I showed earlier. He referred to his remedies only by the numbers 1 through 6 to prevent others from copying his system. And he sought agents to sell his medicines and promote the system. Several friendly botanic societies joined in uniting in a national convention in 1832. One of his rivals said that body heat was not radiating from the stomach, but was due to friction of blood in the arteries. After Thomson's death in 1843, his legacy was carried on by others, and one of them was Dr. Alvin Curtis. Sometimes he's written as Alva Curtis, but I'm going with the spelling in JAMA, Alvin. He formed the first Physiomedicalist school in Columbus, Ohio, and then moved to Cincinnati in 1841. Thomson was opposed to medical schools. He said that doctors learned by the study of patients, not books, and they learned from experience and not reading. Curtis was trying to upgrade medicalism to the point of the regular doctors. The last Physiomedicalism school closed in Chicago in 1911. There had been 12, but only 3 or 4 existed at any one time. The second sect is homeopathy, and this was founded by a respected German physician, Christian Friedrich Samuel Hahnemann. And his life almost overlapped with Thomson. He was born a few years earlier in 1765, but they both died in 1843. He withdrew from medical practice because he thought that conventional medicine did not offer cures and was often dangerous. In 1796, he discovered a new system of healing, which was based on 2 premises. Simila similibus curantur, which was Latin for like heals like, and the second system was the law of dilution. Hahnemann used the term allopathic for regular physicians as derogatory. The term was derived from the Greek term meaning strange or opposite and suffering. So he thought that the allopathic doctors were giving medicines to reverse the symptoms. Sounds right to me. Allopathic physicians, according to Hahnemann, attack the body by giving large doses of dangerous medicines that further weaken the body by reversing the symptoms. And he said that if true quacks exist, they must be the allopathic practitioners, according to Hahnemann. But let's look at his like versus like heals like system. Homeopathy, the term was derived from the Greek term meaning like and suffering. And he said that when drugs are given to healthy people, they produce side effects that are like the symptoms in sick people. He said, disease is not wrong, but it is the right action. Nature is doing her best to cure the patient. And medicine should help the body by increasing the symptoms instead of changing them. His law of dilutions said that remedies were based on serial dilutions of highly purified drugs in a diluent such as water, alcohol, milk, sugar, or a combination. And he did this with what was called succussion. This was vigorous shaking or striking of the diluted substance in a bottle to release the essence of the drug while removing the harmful side effects. And on the right, you can see a medicine derived from poison ivy, which I imagine is diluted enough, is basically a placebo. Physicians disagreed on how many succussions were necessary, and the medicine was administered until the symptoms increased. His cynics proposed that a chicken soup recipe using the law of dilution could be made by allowing a chicken to cast its shadow on a bowl of water. And one of his recipes called for dilution to 10 to the minus 80th power, which was the equivalent of a pinch of salt in the North and South Atlantic Oceans. To document the efficacy of his medicines, he did what was called proving. He took healthy subjects and gave them various preparations. Volunteers kept extensive records of their symptoms throughout the day, and they were observed for months. During this time, they were forbidden from drinking coffee, tea, wine, or eating spices. And even playing chess was forbidden because it was too exciting. Critics criticized the system because they said the studies were not blinded. His medicines were so dilute they were unlikely to use pharmacologically active preparations. His sample sizes were small, and the treatments were individualized for the individual patients, not the same for everyone. And he lacked validated outcomes. An article in the Annals of Surgery in 1998 called his system placebo therapy at best and quackery at worst. Homeopathy peaked in the 19th century, especially in the Midwest, and often in famous people. It is thought that William Wrigley, the owner of the Cubs, Abraham Lincoln, and Susan B. Anthony were all followers of homeopathy. And they had some good results. During the yellow fever epidemic in Natchez in 1835, homeopaths had a lower mortality rate than traditional practitioners. The US Senate passed the Food, Drug, and Cosmetic Act of 1938, recognizing homeopathic preparations as drugs. But the bill was sponsored by the US Senator Royal Copeland from New York, who himself was a homeopathic physician. Some states actually allowed reimbursement for homeopathic remedies and licensing of homeopathic physicians. By the year 1900, there were approximately 22 homeopathic schools in the US, and the last exclusively homeopathic school closed in 1920. Like other sects, homeopathy declined due to the advances in bacteriology, pathology, physiology, and pharmacology. Hahnemann Medical College in Philadelphia survived by merging with Medical College of Pennsylvania. There was a resurgence in the end of the late 20th century due to the rise in chemophobia, the New Age movement, holistic and alternative medicine. And there is even a statue dedicated to Samuel Hahnemann in Washington, D.C. The third sect, which I will discuss, which had degree granting institutions in Chicago, was Eclecticism. And this was founded by Wooster Beach, a few years younger than the other two. He was born in Connecticut in 1794 and studied under a German herb doctor, Dr. Jacob Todd. He was opposed to bloodletting and purging, the treatments advocated by the regular doctors in the mid-19th century. He stated that most diseases respond better to nature's remedies, such as roots and herbs. During an argument, a friend of his called him an eclectic because he was not following one system. He was enamored of the term, and because it implied a lack of a definite medical philosophy. He adopted a flexible approach to therapeutics, emphasizing botanic remedies. He urged people to eat fruits and vegetables and avoid sex. In 1833, he published a 3-volume book. And here's the title of it, at least part of the title. He later revised it and abridged it and published a 906-page book called The Family Physician. And this is the introduction page. You can see how small the fonts are. He published these books at his own expense. This was in the days before computers. Beach attributed many diseases to circulatory imbalance and said that most disorders are due to capillary problems since they hold the greatest blood volume. According to Beach, capillary contraction results in inflammation and arterial impediment. Capillary relaxation results in the free secretion of bodily fluids and tissue flaccidity. And treatment must be directed at restoring the normal vascular tone. In 1832, he cared for over 1,000 cholera patients in New York City and had results at least as good as the regular physicians. He founded the Eclectic Medical Journal in 1836 and was president of their national organization in 1855. Eclectic medical schools opened in the U.S., especially in the Midwest. The first, perhaps, was the Reformed Medical School in Worthington, Ohio in 1832, which closed in 1842. This was the first degree-granting botanic medical school in the U.S., but it failed and was basically run out of town when the citizens of Worthington discovered that people were removing the corpses from the potter's field, the gravesite for the indigent people, to use for gross anatomy. So in 1845, the school moved to Cincinnati and changed its name to the Eclectic Medical Institute, and it closed in 1939. The Eclectics tried to have a curriculum similar to regular medical schools. Beach died poor because he refused to receive payment for his services. He also published his own books, which was expensive because he had a lot of colored plates. Eclecticism, like the other sects, fizzled out by the mid-20th century due to pressure from the American Medical Association and also from the advances in bacteriology, physiology, and other subspecialties. The Eclectic Medical College of Philadelphia was known to be a fraudulent diploma mill, and the last Eclectic Medical School closed in 1939 in Cincinnati. Well, next month, I will be discussing the medical schools in Chicago that have failed. Some of them were followers of these sects, some of them were night schools, and some of them were just downright fraudulent diploma mills. So let's get together again next month virtually. In the meantime, stay safe, stay connected, and I look forward to joining you next month.